Welcome, everyone. My name is Anna Sabino, and I am the Director of Young Adult Programs here at the College Diabetes Network. Thank you all for joining us for this very special event in partnership with ADCES and the CBDCE. We could not have done this without both of these organizations' support. So if you're not familiar, CDN is a national nonprofit organization committed to providing young adults with the peer connections they value and the resources and support that they need to successfully transition to adulthood and live a full and healthy life with diabetes. The engagement of clinicians like all of you who show up after work, very long day, to learn more about how to support this population is not only so inspiring, but truly integral to making our mission possible. We all know there are a lot of perks that come with being an adult, but it can also be really intimidating, especially while managing a chronic illness like diabetes and being a young adult, not to mention coming out of the age in the midst of a global pandemic. We've heard that many of you are here because you've either struggled to connect with or are curious to learn more about how to best serve today's young adults and their ever-evolving needs. I'm so excited for the learnings, the conversations, the discussions that will happen here tonight. And thank you in advance to all of our fabulous panelists and moderator. So I'm going to share a little bit about Kelly. Kelly Rawlings is the Director of Program Design at Vita Health. She develops consumer programs and content for the company's app products and telehealth platforms with a special focus on chronic condition self-management. She's also currently volunteering on behalf of ADCES to revise the National Standards of Diabetes Self-Management Education and Support, and is the former treasurer and board director of the Certification Board for Diabetes Care and Education. She is an active member of the diabetes online community, and very importantly, in 2023, Kelly will celebrate her 50th birthday living with diabetes. One quick housekeeping note, we will be muting everyone's audio tonight, but if you do have questions or comments, please feel free to interact in the chat, and at any time, we may be putting some polls for interactive questions using that feature, and we will have CDN staff members here in the background gathering your questions for Kelly and reviewing your comments, possibly sharing some resources and links to make sure that we get to everyone's questions, and we're excited to have you. So let's kick things off and get started with a brief welcome message from Becky Sulik and our friends at CBDCE.
Hello, everyone. I'm Becky Sulik, and I'm a registered dietitian and a certified diabetes care and education specialist. And I'm coming to you from Idaho Falls, Idaho. And I myself have had type 1 diabetes for almost 37 years. And I'm happy to be representing the Certification Board for Diabetes Care and Education, or AKA CBDCE. There's a lot of acronyms here, right? So we're proud to be a collaborator with CDN since December of 2013. So that's over 8 years now. And we've been so glad to support all the different activities, but while providing our certified individuals the ability to actually learn more about how to support young adults living with diabetes. We're also glad to know that many of the students are interested in actually becoming CDCESs and pursuing certification. So we really like the ability to let younger individuals know about the specialty and the impact that they can make in this community. Early efforts really revolved around supporting students to be able to attend AADE, which is now ADCES, and that started in 2014, and 2 students attended the annual meeting, which allowed them to have some mentors and talk with CDEs, which would now be CDCESs, and other clinicians. And so it really was a win-win to gain access. So the clinicians also gained access to CDN information, what they had available, enabled ability to support their patients and clients. And of course, over the next few years, that collaboration continued in that same vein. In 2018, our organization committed more funds to support CDN activities, including their diversity promotion project. ambassador project work, and a collaboration during CDN's annual leadership retreat. And all these have been very valuable. One especially exciting activity occurred during 2018 was when attendees of CDN's leadership retreat spent some time providing feedback on exam content for our exam outline for the Certified Diabetes Care and Education Specialist. And several possible additions were sent to the Practice Analysis Task Force to be considered, and at least 2 items on the outline were a part of the survey process. The number of students participating in AADE 2018 annual meeting was up to 7 at that point. And then in 2019, CBDE still maintained its support for continuing work on diversity and inclusion efforts that CDN was spearheading, including the ability to have an intern work on that work and continuing ambassador project work. We also looked forward to support CDN's REACH initiative with other organizations, and REACH is reduced risk through education, advocacy, and collaboration in higher education. Along the way, the student experiences at various diabetes meetings and experiences grew into a more impressive program that we now call the Next Gen program. So in 2020, CBDE CE was very happy to continue supporting CDN and enjoyed sharing the news of CDN's 10th, I believe it 10th anniversary, and during College Diabetes Week. Because of COVID and all those barriers that were thrown at everyone, the challenge of converting that Next Gen program to a virtual experience was successful. And so for 2021, we're really happy to continue working with CDN to expand the Next Gen program. And we also enjoyed offering a webinar to CDN community late in October about certification. We're excited for a strong continued leadership. And for those of us that are on here tonight that are healthcare providers, we are really looking forward to listening and learning from our young adult panel. Thank you for having us.
Becky, thank you so much for kicking off what I hope is going to be a fast-paced, lively, and really rich event with all of our participants and our panel. We're gathered here to talk about diabetes and living well, but particularly from the lens of the emerging young adult who's emerging into independence. And I am super excited to learn from our panelists. So from this event, I'm hoping that there are going to be several takeaways. For you providers, I'm hoping that you come away with a few things that you want to try in your practice, your everyday practice. I also hope that you come away with some questions that you want to ask the emerging independent adults that you're actually serving. And I hope that you'll find some resources that you can refer to again and again in your practice. So with that, let's all meet our great panelists. I am going to turn to them, have them say hello, tell you a little bit about where they are right now in their life stage, and maybe just a little bit about their diabetes history. And then we will get into some of your really great questions. So first, Haley, please take it away.
Oh gosh, thanks so much, Kelly. So hello everybody, and good evening or good afternoon wherever you are. My name's Haley Owens. I am currently a senior psychology major out at University of Maryland, Baltimore County in Catonsville, Maryland. And I am studying psychology with a particular focus on looking at the relationships and the dyadic relationships between parent and children affected by diabetes, and how that relationship can impact quality of life outcomes and behavioral management issues or successes in related to diabetes management. I was diagnosed at the age of 9 years old back in 2007, and have had a whole host of different ways of managing my disease or this disease. Currently, I'm on a CGM, and I'm also on a tandem pump, which I love both of those technologies. And I'm working towards finishing up my major and my degree this coming year, and I hope to transition to a PhD program in the following year with a focus in clinical psychology, and would like to one day become a quote unquote, what I've heard kind of a coined term in modern days is a diabetes psychologist, which I think would be really cool. So it's so great to see everybody and hear everybody, and I'm really looking forward to this evening.
Kelly, thank you so much. It's great to hear about your personal life and also what you're doing professionally as you prepare to still stay involved with diabetes. So with that, let's turn to our next panelist, Crystal. We'd love to hear from you.
Hi everyone, my name is Crystal Diaz. I'm currently a third year global disease biology major at UC Davis on the pre-PA track, but I'm planning to graduate early this spring. I've had type 1 diabetes for 2 years. I was diagnosed at age 18 right before I went to college. So CDN was a big part of learning to navigate diabetes in college. Along with being a founding member of my CDN chapter at UC Davis, I'm currently a CDN Next Gen Fellow. This summer, I received a scholarship to attend the Children with Diabetes Friends for Life conference in Orlando, Florida, and I got to meet 2 of our wonderful Next Gen Fellows in person. I'm also currently serving with the Global Perspectives Initiative to build more inclusive curriculum reform in One Health courses. And as a future healthcare provider, I'm really looking forward to hearing what the other panelists have to say as well.
Crystal, thank you so much. Jack, we'd love to hear a little bit about you.
Hi there, everyone. My name is Jack. I'm a senior down at Lehigh University in Pennsylvania. Down for me, I'm originally from Massachusetts. Studying across business, math, and engineering, ultimately trying to understand from a systems and business standpoint how to foster growth and development in healthcare and life sciences sectors. I'll be continuing that journey back up in Boston, where I did grow up after graduation this upcoming spring. About 30 minutes away from where I grew up outside of Boston in Natick. I was diagnosed at 5 years old. I went to Camp Joslin out in Massachusetts for about 10 years as a camper, and actually ended up working at a non-diabetic camp where I took on some T1Ds throughout the summer in my cabins, usually helping them smooth the transition from diabetic camp to a non-diabetic camp. And primarily have been on the Medtronic pump, a little bit of injections, and ever since COVID hit, one actually benefit of that for me, believe it or not, is actually getting on a closed loop system. So that's been amazing, and I'm really excited and looking forward to tonight's conversation.
Great, thanks, Jack. Thanks for taking the math beyond just figuring out your own insulin carbohydrate counts, but also into finance and helping us in the healthcare sector. Julia, you are our next panelist, and then we'll get into questions.
So my name's Julia Blanchette. I was diagnosed with type 1 in 1999 when I was 7 years old. And I'm currently an older young adult living with type 1. I'm almost not a young adult anymore, which is really weird to me, but that's fine. And I've been on an insulin pump since 2000 and a CGM since 2013 when I was in nursing school. I'm currently on Tandem and Dexcom Control IQ. I love it. I was actually doing DOI Loop before, which I also loved. And I went to Case Western in Cleveland for undergrad and grad school, and I've been a registered nurse since 2014 and a certified diabetes care and education specialist since 2017. And my niche areas are actually diabetes technology and barriers to self-management during emerging adulthood. And so I'm currently a nurse scientist and a diabetes care and education specialist at University Hospitals Cleveland Medical Center. And I'm starting up teaching as a clinical professor and adjunct professor soon as well. I just finished my postdoctoral fellowship in integrated diabetes management funded by ADCES and CBDCE. So thank you so much. You're both represented here tonight. I'm so thankful to both. And I did that at the University of Utah. And a fun fact is I've been going to diabetes camp since I was 9, and I still go every year. So I'm really excited to be here.
Julia, thank you so much for rounding out what is a terrific set of panelists. So let's get into some questions. Some of these have been sent in from participants before the event. So thank you for that. And just a reminder, if you want to type anything into chat and post your questions there, we really welcome those, especially if you're reacting or responding to some things you're hearing today. So let's get into your everyday life with diabetes, where you are in your life stage. If you could just talk a little bit about how diabetes is fitting into your life, maybe some good parts of it and maybe some parts that you find challenging. And if you can contrast that a little bit with the way diabetes, affected you, say 5 years ago, 8 years ago. So with that, Crystal, I'd love to hear from you. Just where does diabetes fit and how into your everyday life?
Yeah, I think throughout my day, diabetes is just constantly on my mind, whether it's studying or exercising or hanging out with friends. I always have to think about diabetes. And probably the most annoying part of it is even when I try not to think about it and I'm really focused on studying or really in the moment with my friends, it still manages to bug me through like low alarms or high alarms, or even like feeling really shaky at times. And so it's really hard to not think about it. But at the same time, it's brought some really great things into my life. I have two really close friends that I've met through CDN and through the conference this summer. And so there's definitely good and bad. And yeah, that's pretty much how diabetes has been incorporated into my life now.
Thank you for painting that picture. So just a follow-up question for you. This thought burden, this cognitive load that you have day in, day out as you're going about your things, do you ever talk to your provider about that? I'm curious.
Yeah, I do. I talk about how diabetes burnout is definitely a thing, how I'm up in the middle of the night trying to fight my lows. And we go together and try to fix that, definitely on the medical side. Yeah.
That's great. It's good to hear how you're talking about it. Haley, what about you? What's diabetes' role in your everyday life, good and bad?
Yeah, diabetes is everywhere all the time in my day-to-day life. I mean, it's not only one of my most salient identities, I would say, but it also is a passion of mine. I think if you were to ask me 10 years ago, or even right after I was diagnosed 14 years ago, my diaversary was on Monday, actually. So it's been 14 years. And so if you were to ask me right after I was diagnosed, or even a couple years after I was diagnosed, how does diabetes fit into my life? I would say it would probably be a love-hate relationship, more so on the hate side. And that's okay. And that's perfectly fine. That relationship with diabetes changes every day. Like Crystal, I would say I'm very grateful for diabetes because it has brought me wonderful people into my life. I mean, surely that is a really big benefit of diabetes, is that we have such a wonderful community. But diabetes has also made its way into my education and into my career path. So I started the UMBC CDN chapter back in 2018, and I've been the sort of president, if you will, of the chapter ever since. I've also worked in the diabetes sector for the past 10 years as a part of the diabetes camping community. And I work closely with Camp Possibilities, which is out of Darlington, Maryland. And I work with primarily our young adults who live with type 1 diabetes, and I set up the programs for them. And diabetes has also made its way into, like I said, my career. So right now I'm also doing research with Boston Joslin Center, with one of the psychologists doing diabetes research connected to peer support and quality of life. And overall, I would just say that diabetes is again probably one of my more salient identities. It's a relationship that I have. It's also a passion. It's a part of the advocacy work that I do. And you know, I don't assign any sort of label to it. Diabetes is going to be what it is, and it ebbs and flows every day. And some days it's really good, and some days it's not really too good. But again, coming back to community, we have such a wonderful community, and that really is like the shining light, the shining star out of all of this.
Thanks, Haley. You know, I always say none of us chooses diabetes, but those of us who are living with it and who are healthcare workers in this space and in the overall diabetes community, we're really grateful that you choose to be involved, because that is a choice and it makes so much difference to us. I'm hearing a lot about connections, about people, about support. So we're going to circle back around to some of those ideas and have a chance to hear where you're finding that support. But first, I'd like to hear a little bit, Jack, do these experiences that Haley and Crystal describe ring true to you? Any other lens on that?
Yeah, I would definitely say I have a little bit of a different lens. I went to a small mid-sized school. There wasn't much going on here in terms of any sort of type 1 diabetes related support groups. Although I did come from Boston area and a community where that T1D community was very, very strong. So it was certainly a little bit of a shock coming down here and sort of having to make a lot of quick and difficult transitions at times. So I'm currently in the process of starting up the CDN chapter here at Lehigh. And it's interesting for me because having been a little bit more out of touch than I would say probably Haley and Crystal have been with the T1D community, I am constantly trying to find ways to, get back in touch with that community. Although it is sort of my end game long-term goal to make a positive impact on the healthcare side of things, I still want to have that tangible impact right now as well. I would say from a day-to-day perspective, I'm a very active and I try to eat healthy as well. So going about my daily life with a very set schedule is something I really try to do. Using those different advancements in technology, and sort of the way my mind works is I'm constantly being, I'm intrigued by all the new advancements in technology that keep popping up throughout the T1D community, and how those advancements come to be, like the funding behind it, the work goes into it. So I would say a combination of those different things keeps me driven, keeps me motivated, and helps to lift me back up when I'm going through stages of burnout or feeling a little bit isolated in a community where there aren't that many type 1 diabetics.
Thank you. Thank you for sharing this. So I have a question for you kind of about the structure. I think many of us living with diabetes find that some of the hardest challenges, the things that take up a lot of brain space, is when our routine gets disrupted, when we have to, deal with unexpected exercise or unexpected food choices at an event or a party. I'm curious right now at this point in your life, are you able to structure your routine as much as you like, or has college made that actually more difficult for you?
Yeah, college has made that at first it made it more difficult, but I would say it accelerated the way that I approached my diabetes management. So in high school, it was sort of a little more nonchalant, but now getting here to college, it helped me realize how important that structure is, and how other aspects of my life may have to be sacrificed in order to keep my health as my number one priority. That's been one of the biggest things I've learned about college, is that that structure really is important for me, because it helps keep that health above all else, which I think is a number one priority and should be.
Great, thank you. So Julia, what about you? Your everyday experience, and can you contrast a little bit as you get closer to the end of this sort of age range that we're looking at? And you're on mute.
Yeah, I realized that. Sorry about that. So, I'm definitely on the other end, and I was really thinking about that as you guys were all talking, because especially what Jack said, I had almost like the same experience. Like I, came from a really big diabetes community, went off to college. It was a smaller college, and College Diabetes Network didn't exist, or if it did at the time, I started college in 2010. So if it did exist, it wasn't going to make it to my very small campus at that time. So I really felt like I wanted to reconnect with the diabetes community the whole time. And I really had to figure out, I was a totally normal college kid, but I had a lot of activities. I was in nursing school. I had a lot of factors going on, and it really did make my diabetes self-management a lot more difficult. And I was just thinking, as you guys were all talking, like, I feel like I finally nailed it. Like I have a routine. I'm like, it's such a boring person now, where I have like, my job is like finally, like I have an everyday routine. I always like have a backup plan for everything. And I'm able to actually like think through that and like kind of prepare for that in a way that I feel like was a lot more difficult in college. But the one thing I also wanted to highlight, Kelly, is that if I think back 5 years ago to grad school, so this wasn't a thing in undergrad for me, it was grad school. The biggest thing I was focused on was I was so stressed, and I was so insulin resistant because I was stressed. And so like the big thing 5 years back was, how do I reduce my stress, and like what tools can I use so that I no longer like am dealing with this constant just like stress and heightened insulin need. And so that was like how I found myself kind of getting into some more diabetes online community stuff. and like DIY stuff. But yeah, I think now I feel like I've nailed it, if that's a thing. It's not really a thing, right? Because there's always the potential for diabetes to go wrong, or, for something to happen, but I feel like I'm as close to nailing it as I could be, finally. So
that's a great message of hope for us. I think any age, right, as we go through different life stages with diabetes. So I think, I'm hearing a lot of, again, the importance of establishing contacts with people who get it, people in the diabetes community. And we know that for the practitioners online, that there are some great resources. So your ability to direct your emerging adults to the College Diabetes Network site where they can connect with people. There's a great section on the association's website about peer support and different ways to connect patients to that, whether it's online peer support, in-person peer support, or some kind of hybrid. So I really encourage you to think about your ability to be that facilitator and help people connect to other people who can relate to these everyday challenges. I think it has made a big difference in the lives of our panelists, and I know in my own as well. So let's talk a little bit about moving just from your everyday life where you are studying, work, all those things, to that space where you are together in an exam room with either your diabetes care and education specialist, your diabetes doctor, your diabetes nurse. I'd love to hear what you might say, maybe your top 2 tips on how to make that a really helpful, meaningful, rewarding experience when you are in that room for 15 minutes that we get together, maybe 4 times, maybe 2 times a year. So let's mix up the order a little bit. Jack, are there a couple of things you could recommend as tips to make that a really good experience?
Yeah, so I would definitely say, especially with all the changes that have gone on over the last couple of years, moving virtually and such, communicating clearly and early with a provider has been huge for me. I know it's simple, but it's something that sort of can get lost in the day to day, and just being intentional about doing that from both sides is enormous. I think especially with the back and forth that happens in a virtual environment versus in person, there isn't as much of fluidity in conversation. So I think sometimes it's a little bit, it can be a little bit cut and paste. So having those things laid out beforehand is really important, just so that all those pieces are touched upon and covered, and nothing's missed that in in-person conversation usually wouldn't miss, especially from the patient's perspective.
Great. And thanks for reminding us too that we've all been living in really unusual times, right? Where we haven't necessarily been in the same room together for some of our diabetes care and check-ins. We've been using Zoom calls or other forms of meeting. Jack, I'd like you to think a little bit as we're listening to our next panelist. I'm really curious about what question you get from your provider that you feel is a really good question to encourage you to open up. So be thinking about that, and I'll come back to you and check on you for that. Next, let's go to Haley. Can you give a tip or 2 about how to make that exchange in those office visits really useful and meaningful and rewarding?
Yeah, so it's funny because my endocrinologist also has type 1, and I think about my experience with them sharing that commonality of being able to say, you and I both experienced type 1, and also, comparing that experience to perhaps past providers that just we didn't have that same language. And so I certainly think what made that relationship rapport so much stronger and made it more comfortable to open up about my experiences as a person living with diabetes is that I didn't feel this sort of like gatekeeping experience where I would try to explain myself and they're kind of looking at me like, yeah, well, there's just some things that you count your carbs, but you might give like a lower amount of insulin than is recommended. And it's like, I know my body. I know that this is saying give 2 units of insulin, but I'm gonna go with my gut feeling because of XYZ reasons, and I'm going to give 1 unit of insulin. And so even though after I would like go through all of that time explaining myself why I made the decisions that I made, sometimes I would get a pushback from previous providers that would say like, well, that's not what was written down, which I get. I understand that these are your recommendations. And yet at the same time, I just think it's sometimes best that a provider says, you have your own autonomous and bodily experiences. And those are valid. What you feel comfortable doing and the reasons behind that are not something that you have to like tease out to the nth degree and explain yourself to exhaustion, because living with diabetes is exhaustive enough. And so sometimes I just would like to see more providers, even in a Western medicine climate that we live in. I would like to see more providers prioritize in conversations the psychological and the social experiences that we have as people living with diabetes, and that I'm not always going to get it perfect. And perfectionism really isn't the goal. I don't think it is. I think it's about sustainability, and trying to avoid things like burnout. Like I think that is a big priority. Whether or not I get the ratios just correct, I don't know. I think it's a conversation. And so if providers were more willing to have that conversation and not put on the heat, so to speak, then I feel like maybe we would be able to get to more issues that kind of work behind the scenes that we sometimes don't feel like we're able to talk about because of stigma or judgment, things like that.
That's super helpful. I mean, that's really looking at our diabetes care as our life, right? It's not just the medical condition, it's all the things that surround that. So I think it's really helpful for me to hear you suggest, can we focus more on the emotional, the social side, the psychological side of things? Jack, I hope you're getting that question ready. Haley, I hope you think about how you might phrase that question to get a young adult to open up in these kinds of encounters. But Crystal, first, any tips for making these office visits, the best that they can be?
Yeah, I think definitely sitting down at my eye-to-eye level really helps me feel understood and listened to and included in my decisions about my health. My endocrinologist now sits with me, and it feels like we're on the same level, and I feel so much more understood. Whereas before with my old endocrinologist, it kind of felt very patronizing. You need to do this and demanding. And so I really feel so much better and connected with my new endocrinologist. And that's made a huge significance in my diabetes management. I was able to lower my A1C to 6.9 most recently. So yeah, I was really happy about that.
Congratulations. That's great. And I like some of the points you kind of teased out about how it's a conversation, it's a shared process. It's not a patronizing or dictatorial, do this, do that, right? It's coming together to problem solve, which I think is really rewarding. Okay, Julie, before I get to you and your tips, I'm going to go back to Jack. Jack, how would you phrase that open up question? What have you heard that has helped you?
Yeah, I think maybe not a exact question specifically, but approaching the appointment at first from a non-diabetes perspective. So just like asking the patient how they're doing, what they're going to be doing like in the near future. I think that's something that has helped me a lot and made it, as Crystal was saying, more of an eye-to-eye experience with the provider. So just getting on that same level at first, and diabetes oftentimes will just naturally make its way into the conversation because as a diabetic, it's a part of our everyday lives. So if you ask us about our lives and it's a truthful, honest conversation, it's going to end up making its way in. And I feel like that's oftentimes the best way, at least from my experience, to sort of pull out of me from their perspective what exactly is going on, how I can plan for what's to come, using reflecting on the months that have passed. So I know there's definitely always something to be said for that more human approach as opposed to all numbers all the time.
That's great. Haley, what about you? What words would you enjoy hearing, or have you enjoyed hearing?
I think, honestly, I think I might have said it before, but just to rephrase it in a question form, I think honestly, if somebody was to ask me, what is your relationship with diabetes, describe that, and can you maybe put into words how you think that relationship affects your ability to manage your diabetes, I think is an open enough question to kind of for the conversation to flow and start. But also it's a question that we don't think about. We think about the relationships we have with other people, but we don't think about relationships that we have with ourselves or with our own diabetes. But certainly we have them because we feel it all the time. Or, when you see a blood sugar that's high and you react a certain way and you feel like you have feelings of judgment or shame, that's an indicator of what type of quality of relationship you have with diabetes. I think also another question that I might be inclined to ask is, what is your relationship with diabetes, and how is that relationship associated with the relationships you have with other people who are in your support network, or your parents or your caregivers? Because I think that is also very important to management, is like, who is supporting you? How are they supporting you? Or how does your support system perhaps not support you? And how does that also affect the management? So that opened up probably a lot of floodgates, and can get out a lot of information.
That's great. I love this focus on open-ended questions, focusing kind of outside or beyond diabetes as inclusive whole people. I think there's some really good thought starters here that I hope the providers who are participating are thinking about as they think about the next appointment that they have. So with that, Julia, any tips for you about that encounter?
Yeah, so I'll tell you, I'll tell you what happened to me personally, and then I'll tell you what I do now with patients. So my first adult visit sucked. It was awful. I had no idea what I was getting myself into. The person wasn't warm, and I was used to kind of like a warm, friendly person who I knew, who knew me, who cared about like what was going on in my life. And it was very much just like, okay, why are your labs like this? And that I wasn't ready for, as a 22-year-old. And that's not what I wanted, right? I wanted someone who I was going to build a relationship with, so I could keep coming back to. And so I cycled through 3 adult endocrinology providers until I found the one. And that visit was amazing. Like, we didn't talk about my diabetes probably until the last 10 minutes. It was just about like, tell me about yourself, like, and getting to know each other. And so now when I see young adults who are coming, I work on the adult side right now, but I get sent a lot of young adults who are coming to the adult side. I spend a lot of time doing that too. So obviously if there's like fires I have to put out, like, if they're having a lot of lows or something, we will go over that. But I don't start the visit with that. I start the visit just by trying to get to know them and trying to build a relationship. And I think that can really go a long way, because when you're working with young adults, they're looking for someone who they can come to ideally for a really long time. And a lot of, pediatric providers are really warm and know the whole family and really have that good connection with the person with diabetes and their family. And so a lot of times people still want that, especially as young adults.
That's great. Julia, we just had a really great question come in. Thanks for the participants. And the question, I think, relates to what you've just been talking about. And that is, can you describe how you've experienced healthcare providers who unintentionally add to the burden of diabetes? What have they said and done that has resulted in that? I've
had one healthcare provider who added to the burden. It was that first person I saw as an adult. And it was really just asking why things were a certain way, but it wasn't in a way where they were trying to understand and help me. It was more like that blame. And that made me really stressed. That made me feel really guilty. And like that added a lot of burden. And I think young adults, like, you can't just ask them why your A1C is 7.4 or whatever it was, which to me I thought was amazing. And I had worked hard to bring it down. And I was stressed out from nursing school, and then really excited that I thought I was doing a great job. And then it's like, well, why is it high? And so I just think really understanding where the person's coming from before asking those kinds of questions, because those questions can really cause a lot of distress. And you don't want to do that to someone, because that can really hurt them. So
yeah, thanks for bringing that up. I think that's the sort of making sure that there is some understanding of context is really important, right? And then also, we see all the time, we know in the 7 self-care behaviors of diabetes that problem solving is a really big one and healthy coping is another. So can we have these encounters, make sure that they're drawing on those two skill sets and strengths, when we're exchanging conversation? That's super helpful. Okay, so let's talk about some things that are a little bit of tricky topics, hard topics, because I think these particularly come up in those transition years when we are becoming more independent, we're going away from home maybe for the first time, we're having new responsibilities and new opportunities available to us. And so I'm going to quote a little bit from a poll that the College Diabetes Network ran in 2020 with emerging adults. They had more than 500 responses. And this is talking about some of those tough topics. You may be sort of shocked to learn that of those polled, 27% said that they had never talked about drinking alcohol with their primary provider. 47% said they had never actually discussed accommodations, that would be at school, at work, the things that we need to help take care of our diabetes, and that are actually protected by law in many cases. And then here's a big one. 66% of the participants said they had never talked about sex or intimacy with their provider. These are all topics that are absolutely coming up, things that we're facing, especially I think for the first time, and maybe without all the supports around us when we're looking at these emerging adult years. So I'm just curious if you could think about those hard topics. Did your providers bring those up? Have you brought those up? How do you have those very important conversations? Let's see. Hey, actually, Julia, let's start with you, and then we'll go back in age.
Yeah, so I remember when I was like a teenager and then earlier in college, I would go to my appointments alone, and I had that really good relationship with my diabetes provider. And so, yeah, we'd talk about that stuff, and because I trusted them, right? And I think I was at the point where I understood, like, I wanted to do it safely, right? If I was going to drink alcohol, I wanted to do it safely. And so the way I bring it up with my patients now is, I'm like, it's not, obviously I'm not endorsing drinking under the age of 21, but if you do drink, we want to make sure you're doing it safely. So let's talk about it. Like, what questions do you have? And you kind of like phrase it like that, instead of assuming they do or don't, just kind of saying like, kids drink. We want to make sure it's safe. What questions do you have? And then the sex topic is always hard, but and that is, it's hard to approach, but a lot of times someone, before I see them, will ask them if they're sexually active, and then I'll kind of, go into that if needed based off of that. Before, you don't want to bring it up to someone unless you know, but if I had to ask, I would as well. So, because those topics are important.
They're absolutely important. Jack, what about you? Are these things that you talked about, in your transition or even now with your provider?
Yeah, I definitely think that Julie made a great point with just having those open-ended conversations. And I think for me, those were the most helpful. I don't think that I can't even recall necessarily one that I've had recently, but in the past, when I was entering college, just having those conversations with a professional, but also them putting me in contact with someone who had done it recently. So for example, getting put in contact with someone who, had been in college for 3 years as a high school senior, close to going into college, and having someone like that to talk to about it was just huge, because going into a new environment with all these different stress factors and just so many different things going on, it's really just good to know what your options are, how best to surround yourself in a safe environment with who, with what, and I think those open-ended conversations, as well as having other resources to reach out to, were huge for me.
Thanks. Crystal, what about you and these topics? Have you covered them? How do you make sure that you do?
Yeah, I've actually never covered them with my provider either. That seems like there's a pattern. Um, I've definitely connected with my type 1 friends who I've been connected with through CDN, and that is where I get most of my information, especially being only 2 years diagnosed. I have very little information, and I'm still learning about basic diabetes things. And so life with diabetes things, I'm definitely still learning.
Thank you. Haley, anything else to add about these topics?
Yeah, I mean, I kind of, it was a little bit mixed when I started transitioning to college, because none of my providers, although they had experiences with diabetes, and my main endocrinologist does actually live with type 1, never really did we have a conversation that was so forthright, asking me like, are you drinking? Are you sexually active? All of these things. And that was something that I actually brung up myself, was I'm going off to college and I'm probably going to drink. And so what do you think of that? And I I don't know how many like young adults would do that. I would hope that many of them will, because I think that I always just entered any situation that would arise in my path, as saying, what do I want to get out of this? And how do I want to enter this situation and be able to leave this situation? So if I go to a party, how do I want to leave that party at the end of the night? And do I want to be like 90 and stable and say like I had a beer, I had a fun time, but I'm not like passed out or anything, or like in a really unsafe situation? It's just, I think that when you start transitioning to college, you have to start asking yourself a lot of questions, like, how can I set myself up for success? And so, maybe it's not the best idea to go to a party and the objective is to get drunk. Like maybe that's not something to aim for. Maybe the aim is to say, I want to experience life with diabetes and I want to have fun, but I don't want to put myself in danger. So there's 101 different ways that we can go about talking about safe sex and safe drinking and all of this stuff related to diabetes. And there's probably 101 different ways that somebody can do that safely based on their own experiences. But I think that all of that really is supported by asking yourself, like, how am I going to be able to be safe in any of those situations? And how am I able to prioritize the health of not only myself, but other people as well?
Thank you. That's super helpful. So I think what we've heard from our panelists on this, and also from that poll, is that these are some really important topics that aren't getting enough coverage, that aren't getting explored enough, and they're really part of everybody's well-being and health. So definitely an area to consider for you practitioners as an area to explore with your patients. So I have another great question from the audience, and that is sort of, if you have formally moved into adult care at this point, many people are able to see their peds endocrinologist or peds team for a while, even after that first job or going off to college, especially if you're on your parents' insurance still. But what were some signs that you felt like you were ready to make that transition? And maybe you didn't feel ready or don't feel ready, and that's okay too. I'd just like you to talk a little bit about that. Crystal, could you take that one?
Yeah, I actually, since I was diagnosed at age 18, I saw my pediatrician once about it straight out of the emergency room, and then was referred to an adult endocrinologist because he wasn't sure what to do with me. So yeah, I was really scared because I had just basically all the insurance decisions were on me now. It just came like a landslide. So definitely did not feel ready, but it's something that you have to do. You got to do what you got to do. And so, yeah, I think.
How did you navigate that, needing to learn about insurance? Did you have help from your provider, or did you find any other resources to help you?
Yeah, my mom was definitely my biggest supporter.
Sure.
And we were also between insurances at the same time. And so it was really a mess, but ultimately finding a good my pediatrician was actually able to write out those prescriptions for me. So even though I was still in the process of finding an endocrinologist, I had the insulin, I had the finger pricks, I had everything I needed to be alive until I found an endocrinologist. So that really helped in transitioning me over.
That's great. I think that's an area too that at least I feel like I haven't seen a lot of education about, and certainly had moments in my life where it was missing. And that is really just uninterrupted access to your supplies when you're going through these transitions, whether that's because you're moving to another state, because your healthcare is changing. And we know, we see a lot of that in the news about how challenging that is. But I think looking at that from the lens of a young adult who may have family support, who may not, I think it's a really important area to explore. So thanks for bringing that up. Jack, what about you? Have you made that transition, and what told you that you were ready to make that or start making that to fully adult care?
Yeah, so interesting. I am kind of in a little bit of a gray area here because I'm DIY and I'm like very independent as far as that goes. So my contacts with my providers have been pretty, I would say, relatively minimal. But one of the things that does weigh on me quite a lot, and quite often, is that transition, and not just the transition from who like from like who my provider is now to who it's going to be in the future, and sort of like what the details of that are, but more so, especially going into the working world after college, like the financials, the insurance like information, sort of like that whole like how long can you stay on your parents' insurance, like those things weigh on me a lot, because I realize that's a little bit of a constraint, that it just, not having had a very intentional conversation with a provider about that, it doesn't make me feel confident about just not 100% knowing what that information is and what my options are going to be. I just think that gap in knowledge is a little bit troubling at times, and if I had a conversation at this point, I would definitely be more at ease and more comfortable going off after my senior year.
Yeah, that's really helpful. Julia, actually, you've researched in this topic. Any advice for our audience on this one?
Yeah, so Jack, what you just said, you need my new resource that I just developed during my postdoc project. So I actually developed a health insurance and financial education toolkit for young adults with type 1 with a group of young adults in a community advisory board panel. And it's an online video toolkit series. And I basically developed it based on personal experiences like you just mentioned. And then by identifying the gaps in the research, but also I realized when I was providing care to young adults, no one knows anything about insurance, and that really complicates things. Especially Crystal, you experienced, everything fell on you as an 18-year-old, right? And we have a lot of these young adults who are on state public health insurance that may get kicked off at age 19. And so then they may experience something very similar before they're 26, right? And so I think that can be really stressful because it can disrupt access. And I think there aren't a lot of resources that can help you understand how to advocate for yourself and understand what you need to know. And so once I have that data published and that toolkit published, I will let you guys know because it sounds like it could be useful. So
thank you so much, Julia. That's great. So I think we have time for maybe just one more question, and I'd love to circle back to something that you all have brought up several times, and that is just how important support is, having people that you can go to. And I was curious if you could just speak a little bit more about your experience with College Diabetes Network and how that's provided you with that kind of support and a route to that. Let's go ahead to Haley. Can you talk first?
Sure. So I think I mentioned that I've been a part of the diabetes sector for the past 10 years, working a part of the diabetes campaign community. And one of the big glaring messages that always comes to my mind is that I feel just so much more confident living sort of in my skin and in my body with diabetes when I have a really, really strong support system around me. And this would make sense, right? Because health psychologists would say that one of the number one prevention factors against progressive, disease, disease degeneration would be social support. When you have social support in your life and when you have people around you that support you, it helps to buffer out those risk factors that could lead to disease diagnosis. So it makes sense to have people in your life, not only because those people make you feel good, but they also, the people in your life can help, connect you to resources that might elevate some burden of health management, or connect you to some research or literature, or some sort of educational tool that could maybe steer you in a path or a direction that could offer a solution to a problem that you've been thinking about for a long time as it's related to diabetes. And so CDN has really been a big part of that, because I love the camping community. And I wanted to, when I started my chapter, I wanted to recreate the feel of the camp community, but in a college setting. And so I said, hello, it just makes sense to do that through a CDN chapter. So that we not only have, again, this common language and this common shared experience of having diabetes, but also we could say, hey, I'm a full-time student, and hey, this class really sucks, and hey, this person won't give me accommodations, and I need help. And when you have people in your life that you can share those experiences with and help navigate solutions, you are more prone to being successful, to being healthy. It just makes sense.
Thank you. And thanks to all of you who have been so active in this organization, starting chapters, participating in them, really making sure that this spreads across the country. It's been great to see. So with that, I just want to say thank you so much, panelists, for your open, candid conversation. I want to say thank you to our participants for some really great questions. Of course, an hour is not nearly long enough to talk about all the things we'd like to, but hope that we hit on some points that are great takeaways for you. And with that, I will turn it back to Anna.
Thank you so much, Kelly. And thank you so much for everyone who joined us tonight, to all of our panelists, to our moderator, and to ADCES and CBDCE. I was diagnosed as a 6-year-old and also navigated this crazy roller coaster. And it's weird to think that I'm on the very, very, very older end of young adulthood. I now have 2 kiddos. But I'm CDN is committed, obviously, for the long haul in making sure that the voices of our students and young adults are heard. So you'll be hearing more of them. And just as a follow-up, we'll be sending everyone an email tomorrow with the recording if you'd like to share with colleagues, along with a very, very brief 2-question survey and some additional resources that just in case you missed it in the chat. So thanks to everyone, and have a great night.
Thanks, everybody. I hope you're feeling like 100 for sure after our great event.